Hello, Medicare Advantage Risk Adjustment Operators, Innovators, and Learners. Welcome to another learning series of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. After about 3 months of doing flashbacks and relearning some of the things that we have learned in the past, we are back to having new videos. Thank you for spending the time with us. If you are new to our channel, I know there are many people that have subscribed over the last 3 months. We want to say welcome. If you are a seasoned Hughes Academy student, we also want to welcome you here. If you have not subscribed, I will encourage you to like, to share, and to subscribe because it helps reach several audiences that we may not necessarily reach. I am your host tutor, Dr. Prince Bewa. This month we are starting a new lesson, and it is on PACE programs. If you have been in the Part C and D world, you may or may not have heard of PACE programs. And this month, we'll take time to look a little deeper into PACE programs, their policies, their payments, some of the things that are particularly interesting about PACE programs. I know we will not be able to cover all, but at least we'll get some introduction to PACE programs to help you as you work in the space. If you have been following CMS communications and documents and you are in the Part C, Part D world, you would see PACE in several fronts. For example, earlier this week, CMS released this HPMS memo, and you can see PACE organizations are mentioned here. And this was another memo that was released this week, and you will see PACE organizations as being mentioned: MA, Medicare Advantage Organization, Prescription Drug. And this is the advance notice and the rate announcement. You will recognize that PACE organizations are also specifically mentioned. And if you are new or you've been in this space for a while, PACE is a special program that is here. So this month, we'll be looking at PACE, what makes them unique, what is similar to MA and other programs that are in the Part C world. PACE program, according to the PACE manual, is a capitated benefit for the frail elderly, authorized by the Balanced Budget Act of 1997, that features a comprehensive service delivery system and integrated Medicare and Medicaid financing. A lot of terms that are being used here. The BBA established PACE as a permanent entity within the Medicare program, and it enables states to provide PACE services to Medicaid beneficiaries as a state option. Operationally, the PACE program is unique as a three-way partnership between the federal, between the state, and between the PACE organizations. So per this definition, there are a lot of keywords that are very particularly important for PACE programs. So it's a capitated benefit. It's for the frail and elderly. It's run by the state, the federal, and the PACE organization. It is financed through Medicare and Medicaid, and it is a permanent entity within the Medicare program. These are some of the keywords that are necessarily important in a PACE program. And for a more user-friendly definition, PACE program, which is the Program of All-Inclusive Care for the Elderly, PACE, is a Medicare and Medicaid program that helps people meet their healthcare needs in the community as long as possible instead of going to nursing homes or other care facilities. That is the more user-friendly, beneficiary-friendly definition, and this is seen in the Medicare.gov as opposed to the first one that is from the CMS.gov. That is more a policy-oriented definition. PACE, which is the Program for All-Inclusive Care. So you talked about the two definitions. First one touched on the comprehensive, so Program for All-Inclusive is for the elderly, so they are frail, and they stay in the community as long as possible instead of going to the nursing home. So that is a PACE program. We'll be covering more this month as we look deeper into their payments, some of the interesting facts around PACE program. And one thing that you will see as you study the PACE manual is that although PACE program has certain fundamental similarities with MA and managed care organizations, and from the very first definition we talked about the capitation, and MA is also paid on capitation. Although they share some fundamental things, they are not Medicare Advantage plan. So PACE is not an MA plan. So that's why you will see in the communications Medicare Advantage prescription drug PACE programs because they are fundamentally different programs. And this month we'll be uncovering some of the differences and similarities that are seen within the PACE program. And that is what we have for today. We try to keep it simple, which we'll be building up next week as we go on. If you are new to our channel, or even if you're a seasoned learner and you have not subscribed to our email list, you go to the Hills Academy website and you go to the Risk Adjustment Made Easy page, and you can subscribe to our email list so that you do not miss anything, and you get the chance to also get a signature gift, which is From Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources that compares the different risk adjustment data sources for you easily for free. Otherwise, I will catch you next week as we build up on our PACE programs. Bye for now.